I'm Shannon Weber with Hive, a hub of positive reproductive and sexual health. And I'm here with...
My name is Margaret Lampe. I'm here from the Centers for Disease Control and Prevention in Atlanta, and I work in the Division of HIV/AIDS Prevention.
And we're here in Washington, D.C. It's May 2015, and we're here at the Elimination of Mother-to-Child Transmission Stakeholders Group and expert panel on reproductive
health and preconception care for persons living with HIV.
Thank you. Yes. And you've really led this effort for many, many years, but specifically this initiative around looking towards the elimination of perinatal HIV in the U.S. and wrote the paper that's the framework for that. And I wanted to talk with you in terms of thinking about the success, but also how this applies to other ambitious initiatives. One, how do you define elimination?
So in terms of eliminating perinatal transmission in the United States, even if a woman and her baby get all of the necessary tools that we have at our disposal, a transmission risk of around 1% is still to be expected. So in our country, we say in a country of 4 million births a year, that we would expect fewer than 1 per 100,000 births to be infected. And not only that, and a transmission rate of 1% or less.
Mm-hmm.
So we estimate around 8,500 women give birth a year, so somewhere in the range of 40 to 80 annually. 40 to 80 cases of transmission annually in the whole country, and that those same numbers can be applied to a given area.
And at the last count, there was 162, is it right, transmissions in 2010?
Yes.
So this plan is really still about reducing by about half the number of babies born with HIV.
Correct.
Okay.
Correct.
And then how did you dream up and leverage this concept of this stakeholders group, which is a group of volunteers essentially that have expertise in different areas that come together that all work to, you're the original crowdsourcer, I decided, kind of crowdsource this concept and work towards elimination of perinatal HIV?
Well, someone stated something to me maybe, 10 years ago, something in public health called Brown's Law. And what's that quote or that law is, once a disease or a health problem is near elimination, it's generally the program itself that's eliminated rather than the condition. Because as you get closer to zero, it's usually the money that goes away, because those remaining cases often are so much more difficult and more costly to try to have a true impact on.
Mm-hmm.
So in hearing that and knowing that resources would be going away, federal resources, state resources, human resources, people going to other things that seem like bigger demands, I recognized that we really needed to pool our resources. And within the HIV world, there's a tremendous human resource base, tremendous amount of expertise, knowledge, and passion that I think is unparalleled.
Mm-hmm.
So I could see that, and I wanted to bring that together. And I knew that there's so much that I wanted to learn from the many experts out there, but there were also some very special movers and shakers, and we needed them around a table to make this happen.
Kind of noodle on it and figure out.
Yeah, and not only the folks around the table that work with us, but they have a huge network themselves, like you do.
Thank you. What do you think about these remaining cases and the challenge, and how it relates to Brown's Law or not, and the effort that you put towards it, or that we're putting towards figuring out how to reduce those last cases by at least half?
I think in the cases of perinatal transmission, it's a really tremendous opportunity for public health to look at some of our most vulnerable populations and the issues that they have to deal with. As you know, we have a project called the Femur HIV Project, where we look at some of the most challenged, where the systems have not necessarily served the women and infants very as they needed. And what we are finding in those instances is that HIV is just one of the many, many things that they're dealing with.
Mm-hmm.
And um, so as so oh, I guess I have to say what drives me around these fewer cases is, when do I just get really sick of hearing about something? And
Right.
what I'm really sick of hearing is that, for the moment, it's that a person's mental health or substance abuse needs are not being recognized or met, or if they are
Right.
recognized, they're being, pushed under the rug. And so our current push with our stakeholders group is to work with our partners, and I'm also working with a newly formed group of federal partners around this issue more broadly. It's time for us to tackle that, and HIV transmission is an infectious disease, and it's transmissible. So I think it's easy for folks to get very focused around that. But what's one of the factors that makes that
Right.
happen are all of these other things that folks are suffering from, and are not being fully addressed because,
Mm-hmm.
frankly, they're more complicated.
What do you think is something that you've learned that someone who might be starting another ambitious initiative might learn from your experience doing this?
I would say, just as we were just discussing, uh, build networks. There are so many resources out there that are
Mm.
available for us, and create opportunities for the movers and shakers, the knowledgeable scientists, the great diversity of strengths that we have all been created to bring
Mm-hmm.
together, to bring that together toward a common goal. Have the vision toward the common goal, and don't be afraid. Excuse me, and start with things that are manageable, so that
Mm-hmm.
this diverse group can have some satisfaction in some
Moving
accomplishment,
forward.
and then build upon that. So while it's one of the greatest public health accomplishments, in my opinion, is the near elimination of mother to child transmission. That has built this tremendous workforce that is so committed to women and kids as it relates to HIV. Now, as I said, we're expanding to the other needs that that our population has, and so I would recommend um, bringing bringing the experts together, bring the movers and shakers, focus on a common goal that's manageable, where you can envision some shorter term success. And by short term, I mean like 4 or 5 years,
Right.
and then build upon that.
And what about your nugget around not everything that counts can be
Think,
counted or
right,
easily
right.
counted, which is such a
Well, I
truth.
think, right. So, and I think often that's what drives the passion for people who work around this issue. I think in public health in particular, we rightly focus on the numbers. We look at indicators, we want to count things, we want to know that we're having an impact, and we want to be able to measure it. And it's important for us all to remember that not always do the things that count, they can't always be counted.
Mm-hmm.
And to keep that in the conversation, and that, I think, is one of the important things to remember to help move important issues forward. Yeah.
Thank you for all you do.
Thank
You're
you.
so visionary and have so much tenacity for keeping on with this.
Thank you, Shannon.
Thank